Hello friends, today I am discussing about diabetes. So before starting the discussion, I would share some statistics of it. Like from 1985 to 2013, there is a drastic increase in cases of diabetes from 30 million to 382 million. And moreover, type 2 diabetes cases are increasing much more than type 1 diabetes mellitus because of increasing obesity and increased aging and decrease of exercise, decreased physical activity. These are the causes. And in India, about 65.1 million cases are suffering from diabetes. And what is diabetes mellitus? Let's begin this. Diabetes mellitus refers to a common metabolic disorders which share same phenotype of hyperglycemia, which means increased blood sugar levels. And according to various causes of hyperglycemia, there is an etiological classification of diabetes mellitus. Now, what is it? Number 1, diabetes mellitus type 1, which is again subdivided into two types, which is immune mediated, and other one is idiopathic, the unknown cause, means which is happening because of some unknown reason. And next one is type 2 diabetes mellitus, and third one, which is other specific type of diabetes mellitus, which is occurring due to various reasons. Number 1, defect, some genetic defect in beta cell development and function, and in this various enzymes or genes are responsible for it, which I will be mentioning in my description. If you want to know about that, you can see the description below. And other thing is, there is genetic defect in insulin action. Alright, and there are some exocrine pancreas disorders in which there is hyperglycemia, like pancreatitis, patients who underwent pancreectomy, or patients suffering from cystic fibrosis. And there are some infections in which hyperglycemia is common, like Coxsackie virus infection, cytomegalovirus infection. There are some various syndromes in which hyperglycemia is common, like Klinefelter syndrome, Turner syndrome, and there are some endocrinopathies in which hyperglycemia is common, like Cushing syndrome, hypothyroidism, and much more. So next we have to go how we diagnose it. For diagnosing, we should know about its symptoms and its 4 criteria of diagnosis. Symptoms are polydipsia, increased thirst, polyuria, increased frequency of urine pass, micturition, and weight loss. These are the 3 main symptoms of diabetes mellitus. Now, what are the 4 criteria? Number 1 criteria is, if patient is presenting with symptoms of diabetes mellitus and if tested, random blood sugar levels more than 200 milligram per deciliter. And the next one is fasting plasma glucose levels more than 126 milligram per deciliter. And third one, HbA1c more than 6.5%. And third one, 2-hour plasma glucose levels more than 200 milligram per deciliter after a oral glucose tolerance test. So that was all about the total 4 criteria. which you should know for diagnosing it at a right time. Now, I would like to discuss what are the screening methods we are using currently for diagnosing it at an early phase, or why we are using it. For that, we are having HbA1c levels and fasting plasma glucose levels. Why we are using these two parameters? We are using these two parameters only or mainly because many of the patients who are suffering from diabetes mellitus are asymptomatic, and the criteria which I told you earlier, they are meeting the criteria of diagnosing diabetes mellitus. That was the main cause. Second one, various studies which have suggested type 2 diabetes mellitus may present even a decade before at the actual diagnosis take place. Alright? And the next thing is, there are some individuals who are already presenting with complications which are seen in diabetes mellitus even without diagnosing. So those complications are leading to diagnosing of diabetes mellitus. And American Diabetes Association recommends screening 3 yearly of people more than 45 years of age, or who are at least obese or having BMI more than 25 per kg per meter square. And we should screen early, at an early age, when people are having at least one or more risk factors, and BMI is also more. Now there arises a question, what are the risk factors of developing diabetes mellitus? For developing diabetes mellitus, there are various risk factors like, number one, as I told, obesity, decreasing exercise, patient having hypertension or other cardiovascular disease disorders, and patient having history of gestational diabetes mellitus. And sorry, I forgot to mention, I mentioned 3 types of classification. Fourth one was gestational diabetes mellitus. Here I remember. And if patient is suffering from gestational diabetes mellitus, that means hyperglycemia in pregnancy, then that patient may develop type 2 diabetes mellitus in 10 or 15 years later. That is why patients suffering from polycystic ovarian disorder, you can see that my previous video on PCOD also from my description link below. And finally, patient who are tested for blood cholesterol levels, if HDL is less than 35 milligram per deciliter, and triglyceride levels if more than 250 milligram per deciliter. So that was all about the risk factors which are mainly play a role for creating a risk for developing diabetes mellitus. And if you want to know about its pathogenesis, how insulin is synthesized in your body, and what can you do for preventing it, what exercises you can do, what are the diet modification you can do for preventing its complications, or what are all the complications you can develop if you are suffering from diabetes, you should stay tuned for my next video on that topic. Alright, till then, bye bye, and do not forget to press the subscribe button and do press the bell icon, so that whenever I post the next video, you should immediately get noticed about that. So take care, bye bye.